Hello everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics. I love showing off great cases that illustrate great points. So I'd like to introduce you to my friend and my patient Paul. And Paul came to us looking for a nicer smile. One of the things that I always say about why I love my job so much is that I love giving people the confidence to smile bigger. Because it was my own transformative orthodontic experience when I was a teenager, and orthodontics allowed me to smile bigger and feel more confident about who I was. I felt like it just really unlocked some of the potential that I had within me, but I was kind of not yet willing to show. And so I often think about that transformation and that unlocking that potential with my adolescent patients. And I love working with teenagers, but I also love working with adults because I think that the same thing can be true for adult patients. And so when Paul came to me looking for a nicer smile, one of the things he said was, this is something that I've wanted for a long time, and just various reasons that he couldn't pursue that earlier in life. So just as a close-up, point out a couple things. Obviously, you can see that we're crowded on both the upper and the lower teeth. In particular, this one upper front tooth right here, the upper left lateral incisor is behind the lower left lateral incisor. We call that an anterior crossbite. And crossbites can interfere with the way that the jaws work. So it's a much healthier bite to be able to get that tooth forward and forward of the lower front teeth, in addition to it being aesthetically pleasing as well. One of the other things I also want to call attention to is the recession that exists down on this lower incisor right here. Because that tooth was further forward, it's getting hit as part of the bite, and it's actually being knocked forward and out of the bone. And that's why the gum recession is happening right here. As we look at the lower teeth, you can see there's that one lower tooth that's too far forward. You can see the crowding of the lower arch. Here's the upper teeth. And again, if you look at the positions of those lateral incisors, not the two front teeth, but the next two teeth, wow, they're far back compared to where they are relative to the central incisors. So our goals was to get that totally straight, and we brought those lateral incisors forward. I am supporting them with this bonded retainer. This bonded retainer goes across the front four teeth, and it's helping to hold these lateral incisors forward. Now we also have a removable retainer that will also help keep those forward and help maintain some of the changes that we made, but what a difference. These are the lower front teeth. Again, in order to help preserve some of the resolution of the crowding that we got, I placed this lower bonded retainer behind the lower six front teeth. And here's a look at Paul from that start. Note that we have less gum recession on this lower tooth because it's been brought back into the arch and it's no longer hitting in a traumatic way these upper front teeth. So some pretty amazing changes. This, of course, is my favorite change. Just wow, what a nice smile, and to see Paul confidently displaying that smile really just warms my heart. So if you want to see kind of some before and afters, these are the lower front teeth. Again, you can see how we resolved the crowding of those lower front teeth. We did this treatment with Invisalign. It took somewhere between 1.5 years and 2 years. So it was a little bit longer than what I expected, but I had a great patient in Paul who was patient with me, and so we got the job done. These were the upper teeth. Again, look at the difference in the positions of those lateral incisors. Quite a big difference. Difference in the frontal view. Again, note how there's less recession as we brought this lower incisor kind of back into the arch. So I really love that. And again, my favorite, the difference in the smile. And so really happy that we were able to do this for Paul. Paul was so grateful when we finished, and this is us kind of celebrating him and his achievement of being finished, that he gave me this big hug, and I was scared that he was going to break me or my glasses, but the hug was just such a great sign of appreciation. And Paul, I know you appreciated what we did for you, but we appreciated you, and we appreciated you being an amazing patient. We appreciated seeing you smile along the way, and I'm just so happy for you, and so happy that we can unlock some of that confidence in you, that you can smile bigger and more fully. And whether you're an adolescent or a grown adult, it's just great to see people smiling big and feeling good about themselves. And that's the best part about being an orthodontist. That's the best part of working in an orthodontic practice. And we love seeing lives transformed like this. So thank you, Paul, for being a great patient. And if you know somebody in need of a smile transformation, send them my way. Love to help.